Hi, this is Dr. Knowles. In this video, I'm going to share a short video created by an emergency room pediatrician, and she's going to show you what respiratory distress looks like in an infant and small child. All of the children in this video have bronchiolitis, and she'll define several of the terms that she uses in the video, and then we're going to break down the term bronchiolitis. And then we'll look at the anatomy and briefly define a few more terms that she uses in her presentation. Here are the terms that she uses in her presentation: tachypnea, dyspnea, breathing effort, retractions, bronchiolitis, as I mentioned, head bobbing, high flow oxygen and vapotherm, and then she mentions altered mental status. And I thought that was worth talking just a little bit more about.
If your baby is doing this, it's time to head to the emergency department. These are retractions, the skin sucking in between the ribs there, and that's a sign of respiratory distress. If you take a little peek at his tummy here, he's actually using some extra muscles to breathe, and he's breathing pretty fast. That's tachypnea. Same little guy, you can see he's sucking in here between the rib cage and the tummy. This is some belly breathing and some retractions here as well. He's about a year old and he has something called bronchiolitis. We started with some suctioning, but he did eventually need some respiratory support. This little guy is 3 months old. He also has bronchiolitis, and you can really see here just under that rib cage just how deep he's pulling, using all of those extra muscles to try to breathe. This is respiratory distress, and he's also breathing really fast. Look how many times a minute he's breathing. Same little guy after suctioning. This is head bobbing that he's doing here, and this is a sign that he's still working kind of hard to breathe. So we got him started on high flow nasal cannula or vapotherm. This is a little 8-month-old, and he has some mild increased work of breathing, not as obvious as the other guys, but some retractions that you can see over here. And then he is tugging here, but he's also happy. We call kids with bronchiolitis happy wheezers. Sometimes it's hard to know if your kiddo's sick enough to go to the doctor or if they need to go to the emergency department. But if they're showing signs of respiratory distress, they're starting to get dehydrated or have altered mental status, it's time to head to the emergency department.
So we're going to go ahead and break down the term bronchiolitis. So in bronchiolitis, the bronchioles are one of the smallest subdivisions of the bronchial tubes that are leading to the alveoli, or the air sacs where the gas exchange occurs inside the lung. So let's look at the root word, which is bronchial, or bronchio would be the bronchiolo, would be the combining form. But in this term, we don't really need the combining vowel because the suffix we're going to add is itis. Itis is spelled with an I, it comes with a vowel, so we really don't need that combining form vowel. So the suffix means inflammation of. So if we're going to define bronchiolitis, we're going to say that it is inflammation of the bronchial tubes. So in this slide, I just wanted to take a closer look at the structures, the anatomy. When you look at the bronchioles, you'll see here that it's that structure, as I mentioned, just before the alveoli. And in the second structure, you'll see just how tiny those bronchioles actually become before they get to the alveoli. And this is important when you're thinking about the inflammation that occurs with bronchiolitis. So what is bronchiolitis? Bronchiolitis is a viral infection that affects children younger than 2 years old, usually. It causes the airways or the bronchioles in the child's lungs to narrow, which makes breathing difficult, which we saw in the video. The symptoms are similar to the common cold: runny nose, cough, in addition to noisy breathing or wheezing, as the pediatrician mentioned in her video. And the viruses that cause bronchiolitis are very contagious. Some of those viruses are RSV, which we talk about a little bit or have information on in our course page, as well as the flu. Here again, just to reiterate, those tiny little bronchioles that get so congested with the inflammation that occurs with bronchiolitis. And there's two reasons that kids under 2 usually get bronchiolitis, and that's because their immune system is immature. And secondly, it's because those little bronchial tubes are so tiny, it doesn't take very much inflammation or mucus to clog them up to make breathing difficult for the kids. So let's answer this question, like, what is a virus? And so in doing little research, I curated some information from the Cleveland Clinic that I thought was really kind of descriptive and a little bit cartoonish. So I created this cartoon. And how they describe it is that a virus is a small piece of genetic information in a carrying case or a protective coating that's called a capsid. Viruses are not made up of cells, so they don't have all the equipment that the cells have so that they can make copies of themselves. So instead, they carry the instructions with them, as you can see in my cartoon here. But they need to have a host cell's equipment to make more copies of themselves. So they use this analogy. It's like somebody breaking into your house to use your kitchen. The virus brought its own recipe, but it needs to use your dishes, your measuring cups, your mixer, and your oven, of course, to make more copies of themselves. And unfortunately, they leave a big mess behind when you finally kick them out. And she also talked about a therapy that used for the kids with bronchiolitis. It's called Vapotherm. Vapotherm is a system that delivers high flow, heated, and humidified oxygen via a nasal cannula. And you can see in the picture here, this is a nasal cannula. This is those little probes or probes, that's not the right word, but anyway, that actually stick inside the patient's nose, in this case, a child. And it's a mask-free alternative for respiratory support. And the reason why this is emphasized is because, generally speaking, when you want to give high flow oxygen to a patient, you need to use a mask. But this particular system has a smaller bore to the cannula, so it allows a higher velocity of oxygen to be delivered to the patient. And it's much better received because it's more comfortable, making it more tolerable for the patient, especially a child, and they can be more compliant with it, but they're able to eat and drink and talk or cry or and also to take oral medications. So often, in my experience, when you try to put a mask on a patient that's having a difficult time breathing, they don't want the mask because they feel claustrophobic. So this is actually a pretty inventive way of delivering a higher flow of oxygen or a higher percentage of oxygen to the patient. And I thought it was important that we talk about altered mental status. I think that most people understand what altered mental status is when you're thinking about an adult, but it seems kind of like a funny term to talk about when you're talking about a baby. So it's important to kind of know, what does altered mental status? And we just had the neuro system in our course, so I think it's appropriate to talk about it. In a child, it can be a change in the way they respond to their environment or to stimuli in their environment. And of course, it's all dependent upon their age. It's age specific. So, and it can be very subtle. So it's important to really watch a child if you're in the caretaker. It can range from anything from being irritable to angry to sleepiness to decrease interactions altogether. Or someone who may not be aware of their entire environment, or they're agitated, or you can't wake them up at all. They're lethargic, which means they're totally exhausted, they have no energy, and they're not responsive. Or total confusion or disorientation, or they lose consciousness altogether. That is what altered mental status can mean. And again, it's dependent upon the child's age. But if you're talking about an adult, it's very important to know what their normal mental status is to compare whether or not this is altered. So thank you very much. I hope this is helpful for you. See you in another video.